students, this is Shahada here, Department of Zoology, Maharani Science College for Women, Bangalore. In the previous session, we had discussed about an autoimmune disorder, that is myasthenia gravis. Now, let us recall what do you mean by myasthenia gravis. Myasthenia gravis is a chronic autoimmune disorder in which antibodies destroy the communication between the nerves and muscles, that is, the neuromuscular junctions, resulting in weakness in the skeletal muscles. So, in today's session, we are going to continue with the another part of autoimmune disorder, that is rheumatoid arthritis. Rheumatoid arthritis is a chronic, progressive, and disabling autoimmune disease in which the immune system mistakenly attacks the tissues in the joints, causing inflammation, that is, painful swelling in the affected parts of the body. Here, it mainly affects the joints which are freely movable, like the joints of your shoulder, knee, and the wrist bones or the phalanges, and cervical spine, etc. So these are the common freely movable joints which get affected in case of rheumatoid arthritis. Now let us see what happens exactly in case of rheumatoid arthritis in detail. So moving on to the contents here, we are going to start off with the introduction to rheumatoid arthritis, definition, causes, types, symptoms which include both non-joint and joint symptoms, diagnosis and treatment. Now, before going to explain what is rheumatoid arthritis in detail, let us know and understand some of the terminologies which describe the disease in much simpler way. So here I have listed out some of the terminologies here. The first one is chronic. Rheumatoid arthritis is a chronic disease which persists for a longer period of time. And the second word is systemic. It can affect your entire body. The third word is autoimmune, relating to the changes in antibody leading to the autoimmune diseases. Inflammatory, causing swelling and pain in the joints. Symmetrical. Here the word symmetrical means if your left hand side bones are affected, even your right hand side bones also likely to be affected. And disabling disease. So it mainly affects a person's movements, senses or activities. And the last word I have given here is polyarthritis. So here affecting more than 5 joints in a body system is called as polyarthritis. Poly means many, arthritis means joints. Polyarthritis. Next, moving on to the introduction here. So here you can understand what is rheumatoid arthritis in detail. Here, rheumatoid arthritis is a chronic, systemic, autoimmune inflammatory disease characterized by a symmetrical inflammatory polyarthritis. So polyarthritis is a term used when at least 5 joints are affected, like the joints of your hand, wrist, feet and knee. And usually the same joints on both the sides of the body will get affected. So this multiple joint inflammation may result in joint swelling, pain, stiffness and possible loss of function. It seriously affects the life quality of the patient. Rheumatoid arthritis is different from osteoarthritis, which is the common arthritis that often comes with the older age. So moving on to the etymological meaning here. So the word rheumatoid arthritis is derived from the Greek word rheuma, meaning that which flows, and the suffix oid meaning like, because of the way it seems to spread or flow within a patient's body. Here, this disease or the disorder has the capacity to spread through the entire body, That is why it has got the meaning like spread or flow. So that is the meaning of rheumatoid. Next, coming to the arthritis, it has taken from Greek word arthron, meaning joint, itis meaning inflammation. Altogether, rheumatoid arthritis means inflammation of the joints which can spread throughout your body. Next is etiology. So, rheumatoid arthritis results from autoimmunity in which the body's immune system attacks its own healthy tissues. That is, tissues in the joints called synovial tissue, also known as synovium. Other causes include lifestyle, genetic, and environmental factors. Next is epidemiology, nothing but distribution of disease. Here, rheumatoid arthritis is estimated to affect approximately 0.24 to 1% of the population, and it is common in women compared to men. Coming to the age here, rheumatoid arthritis can occur at any age, but it most commonly begins in the middle age. When it occurs in children between ages 1 to 16, it is called as juvenile rheumatoid arthritis. When it starts between the ages 60 and 65, it is called elderly onset of RA. When it starts at the early ages, anything less than 30, it is called early onset of RA. The age at which the disease most commonly starts in women between 40 and 50 years of age, and for men in their 60. So these are the different types of rheumatoid arthritis based on the age. First is juvenile, next is elderly onset of RA, and the third one is early onset of RA. Next, coming to the definition here, rheumatoid arthritis is a long-term autoimmune disorder primarily affecting the joints, causing joint inflammation and pain. It happens when the immune system doesn't work properly and attacks the lining of the joints called synovium. Within the body, joints are the points where two bones come together and allow for movement. Most of these joints are called synovial joints because they are covered by synovium. This synovium produces synovial fluid. As the disease progresses, the synovium, which produces synovial fluid, swells and thickens, producing an excess amount of synovial fluid. This in turn leads to further swelling and inflammation, which causes pain and stiffness in the joint. Rheumatoid arthritis is a systemic disease, which means it can affect the whole body. It is also a progressive disease. When it left untreated, inflammation can start to develop in other parts of the body, causing various potentially serious complications that can affect other organs such as heart, lungs, and nerves, and could cause significant long-term disability. So, early diagnosis and intensive treatments are important. The sooner you start the treatment, the more effective it's likely to be. So, this is about the definition here. So, here I have the picture for the joints which involved in the rheumatoid arthritis. So, here the shoulder joints, elbow and wrist and the phalanges will get affected, and also the hip bone, kneecap, ankle bone, and toes. So these are the common joints which get affected in case of rheumatoid arthritis. So you can see that in the pic here. So here both the right hand side and even the left hand side bones are affected. So that is the meaning of symmetrical disease. Now moving on to the causes here. As we all know that all the autoimmune diseases results from change in the immune system, where some of the antibodies are directed towards the destruction of healthy cells or tissues. That is nothing but autoimmunity, which results into autoimmune diseases. So in case of rheumatoid arthritis, the immune system mistakenly attacks the tissues in the joints called synovial tissue. So in a healthy person, the immune system fights off the invaders such as bacteria and viruses, whereas in patients with autoimmunity such as with rheumatoid arthritis, the body's natural self-defense system gets confused and starts to attack your body's healthy tissues in the joints. So to understand how rheumatoid arthritis develops, we need to understand how a normal joint works. Now let us see. A joint is a part of your body such as your elbow or knee where two bones meet and are able to move together in certain directions and within certain limits. For example, the knee is the largest joint in the body and one of the most complicated bone. It is strong enough to take our weight and must lock into position so we can stand upright. It also has to act as a hinge so we can walk and needs to twist on turn when we run or play. The end of each bone is covered with cartilage that has very smooth slippery surface. The cartilage allows the ends of the bones to move against each other almost without rubbing. The joint is held in a place by the synovium, which contains thick fluid to protect the bones and the joint. The synovium has tough outer layer that holds the joint in a place, and also there are tendons which anchor the muscles of the bone, thereby stops the bone moving too far. So this is the description of a healthy joint. So here I have the picture which has got the labeling, that is the muscle, tendon, the cartilage. So this is the cartilage here. So this is the cartilage and the bone, joint capsule which is covered by the synovium. Synovium, that is in sky blue color, having synovial fluid. So this is the description of a healthy bone or a healthy joint. Now let us see what happens in a joint affected by rheumatoid arthritis. Here the immune system mistakes the body's cells as foreign invaders and releases antibodies or inflammatory chemicals, that is rheumatoid factor. So I have given in brackets RF, which is also known as RF factor, or the antibody anticyclic citrullinated peptide, also known as anti-CCP in their blood. So these antibodies target their own body tissues, the synovium, that is the lining of the joint, that produces a synovial fluid to help the joint to move smoothly. So when the immune system mistakenly attacks the joint it causes the swelling of the synovial tissues, leading to the inflammatory processes. So here again I have the picture for the joint affected by rheumatoid arthritis, having the labeling such as muscle, ligaments, and here you can see the synovium, which is in yellow in color, which is getting inflamed across the joint surface, and also there is a thinning of the cartilage, which is denoted in sky blue color. And one of the main factor is erosion of the bone. So you can see here like this, the erosion of the bone, and the synovial fluid is also increasing here, which in turn leads to swelling in the joint. So this is the description of a joint affected by rheumatoid arthritis. Now, other possible causes are listed below. Like the first one is age. Rheumatoid arthritis affects adults of any age, although most people are diagnosed between the ages of 40 and 60. Next factor is gender. Rheumatoid arthritis is 2 to 3 times more common among women than men. And third is genetic factors. It is thought that having a relative with the condition increases your chance of developing the disease. Next is environmental factors include smoking. Cigarette smoking increases your risk of developing rheumatoid arthritis, particularly if you have a genetic predisposition for the developing disease. Next is weight or obesity. If you are overweight, you have a significantly greater chance of developing rheumatoid arthritis than if you are healthy weight. Next, types of rheumatoid arthritis. So there are 3 types of rheumatoid arthritis. First is seropositive RA, second is seronegative RA, third is juvenile RA. Now let us see what is seropositive RA. If your blood test gives positive results for the protein called rheumatoid factor or the antibody anticyclic citrullinated peptide, it means your body may be actively producing an immune reaction to your normal tissues and inflame your joints. Your chance of developing RA is 4 times greater if your parents or siblings test positive for RF. Approximately 80% of people who have rheumatoid arthritis are positive for RF. If the condition occurs due to the presence of RF factor, it is called seropositive RA. Next is seronegative RA. People who test negative for RF factor or anticyclic citrullinated peptide in their blood can still have rheumatoid arthritis. People who test negative for RF and anti-CCP tend to have milder form of RA than those who test positive. So, if the condition occurs due to the absence of RF factor, it is called seronegative RA. Next, third type is juvenile RA. Juvenile RA is the most common type of arthritis in children younger than age 17. Symptoms may be temporary or last for a lifetime. Like adult RA, symptoms of juvenile RA include joint inflammation, stiffness, and pain. If the disease is severe, it can cause eye inflammation and interfere with a child's growth and development. So these are the types of rheumatoid arthritis depending upon the presence or absence of RF factor. Next, coming to the symptoms here, symptoms of the disease can be divided into non-joint symptoms and joint symptoms. Let us see what are non-joint symptoms here. So, general non-joint early symptoms of RA include fatigue, low-grade fever, loss of appetite, unintentional weight loss, sweating, dryness, that is dry eyes, chest pain, etc. Next, recurrent bouts of fatigue along with general sense of not feeling well may occur for weeks or months before other symptoms. As the disease progresses, these symptoms may accompany joint-related symptoms during a flare. Next, let us see what are the symptoms of joints. The first is stiffness. So, morning joint stiffness is a strong indication of RA. Joint stiffness usually lasts anywhere from 1 to 2 hours and sometimes longer. Stiffness and decreased range of motion can eventually make simple daily tasks difficult for the patient. With time, multiple joints are affected like polyarthritis, and most commonly involved are the small joints of the hand, feet and cervical spine. Next is joint swelling and pain. So when the disease is active, affected joints become red, swollen and painful and feel warm to the touch. In the early stages of RA, smaller joints in the hand, wrist and feet tend to be affected first. Over time, larger joints in the knees, shoulders, hips and elbows may be affected. What differentiates RA from other types of arthritis is RA symptoms attack symmetrically. That means that if your left wrist is inflamed, your right wrist likely will be inflamed as well. Next is symptoms of joints having deformity. So chronic inflammation caused by RA over the long term may cause damage to bone, cartilage, tendons and ligaments. In advanced stages, RA can lead to extensive bone erosion and joint deformity. A severe symptom of RA is twisted fingers and toes bent at unnatural angles. Severely disfigured hands can impair fine motor skills and make performing daily tasks challenging. Now let us see deformities of the hand. First is ulnar deviation. It is also known as ulnar drift. Is a hand deformity in which the swelling of the metacarpophalangeal joints become swollen and cause your joints or fingers to bend abnormally towards your little finger. So you can see in the picture I have given a normal hand and an X-ray image of ulnar deviation where you can see the bent of joints towards its little finger. Next is boutonniere deformity or buttonhole. Describes a medical condition in which the finger is bent at the proximal interphalangeal joint and there is a hyperextension at the distal interphalangeal joint. So you can have the picture here. The first is the normal image which shows the flexion and extension. In the second image, you can see the X-ray image. Next deformity of hand is swan neck deformity. Swan neck deformity is a deformed position of the finger in which the joint closest to the fingertip is permanently bent toward the palm, while the nearest joint to the palm is bent away from it. The resulting shape looks like a swan neck. So that is why it is called as swan neck deformity. So here I have the picture for the swan neck deformity. The first one is the normal image and the second image is the X-ray image of that. Next is Z deformity. Consists of hyperextension of the interphalangeal joint, fixed flexion and subluxation of the metacarpophalangeal joint, and gives a Z appearance to the thumb. So in the pictures you can clearly observe how thumb is looking like a Z. So that is why it is called as Z deformity. So these are the common deformities in the hand. Coming to the deformities of the foot, first one is hammer toe. A hammer toe is a deformity that causes your toe to bend or curl downward instead of pointing forward. This deformity can affect any toe on your foot. It most often affects the second or third toe. So in the picture you can see the foot here, how it has bent like a hammer here. See? So this toe has bent like a hammer, right? So that is why it is commonly called as hammer toe. Next is mallet toe. A mallet toe refers to an upward bend at the joint. It may cause the toe to look curled instead of flat. Mallet toe happens mostly in the second toe next to the big toe. The third deformity in the foot is claw toe. Claw toe is a common foot deformity in which your toes bend into claw-like position, digging down into the soles of your shoes and creating painful calluses. So I have the pictures for the both. First is mallet toe and the second is claw toe. Next is deformities of the skin, which include rheumatoid nodules. Rheumatoid nodules are firm lumps of tissues that grow under the skin at bony pressure points. Rheumatoid nodules are most often found on elbows, but they can be found on other areas of the body, such as on the fingers, over the spine, or on the heels. They are usually painless and can appear alone or in clusters. So in the pictures, you can clearly observe the nodules on the hand and on the elbow and also on the fingers. Next, symptoms throughout the body. In severe cases of RA, persistent inflammation may affect other areas of the body such as the eyes, lungs, heart, and blood vessels. Long-term inflammation may cause severe dry eyes and mouth, rheumatoid inflammation of the lung lining, inflammation of the covering of the heart, reduction of the number of healthy red blood cells, a very rare yet serious blood vessel inflammation that can limit blood supply to tissues, leading to tissue death, called as vasculitis. So that is why rheumatoid arthritis is called as systemic disease, because it can affect your entire body. Next, coming to the diagnostic test. So we have a number of tests to diagnose rheumatoid arthritis. The first one is lab and blood test, personal and family medical history, physical exam, antibody blood test, complete blood count. It helps your doctor find anemia, which is common in RA. The sixth one is erythrocyte sedimentation rate. This measures how fast your red blood cells clump and fall to the bottom of glass tube within an hour. Your doctor might call it as SED rate. Next, seventh is imaging test, which include X-rays, can show whether a joint is damaged or not. Next is magnetic resonance imaging, which is also known as MRI, which gives a more detailed picture of your joints. These scans are not normally used to diagnose RA, but they can help doctors to find it early. So these are the different types of diagnostic tests to detect rheumatoid arthritis. So again, I have the pictures for each one: antibody blood test, ESR test, CBC test, X-ray and MRI. Next, coming to the treatment here. There is no cure for rheumatoid arthritis, but clinical studies indicate that remission of symptom is more likely when treatment begins early with medications known as disease-modifying arithmetic drugs, known as DMARDs. Here, medications include NSAIDs, known as non-steroidal anti-inflammatory drugs, can relieve pain and reduce inflammation. Over the counter, NSAIDs include ibuprofen and naproxen sodium. Side effects may include like stomach irritation, heart problems and kidney damage. Next is steroids. Here, corticosteroids like medications such as prednisone reduce inflammation and pain and slow joint damage. Side effects may include thinning of bones, weight gain and diabetes. Next is conventional DMARDs, that is disease modifying arithmetic drug. These drugs can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Common DMARDs include methotrexate and hydroxychloroquine. Side effects vary but may include liver damage and severe lung infections. Next, biologic agents, also known as biologic response modifiers. This newer class of DMARDs include Orenica, Cimzia. These are the drugs. These biologic DMARDs are usually most effective when paired with conventional DMARD, such as methotrexate. This type of drug also increases the risk of infections. So these are about medications in rheumatoid arthritis. Next is surgery. So if medications fail to prevent or slow joint damage, you and your doctor may consider surgery to repair damaged joints. Surgery may help restore your ability to use your joint. It can also reduce pain and improve function. Rheumatoid arthritis surgery may involve one or more of the following procedures. First is synovectomy. Here, surgery removes the inflamed lining of the joint, that is synovium, can help reduce pain and improve the joint flexibility. The second is tendon repair. Here, inflammation and joint damage may cause tendons around your joint to loosen or rupture. Your surgeon may be able to repair the tendons around your joint here. So here the picture is there for synovectomy and tendon repair here. You can observe. Next is joint fusion. Surgically fusing a joint may be recommended to stabilize or realign a joint and for pain relief when a joint replacement isn't an option. Next is total joint replacement. During joint replacement surgery, your surgeon removes the damaged parts of your joint and inserts a prosthesis made of metal and plastic. So you can observe the pictures of joint fusion and also the total joint replacement where they are using the metal elements to fix the joint. So this is about today's session where we discussed about rheumatoid arthritis in detail, where we included the introduction, definition, causes and types, symptoms, where we discussed about two types of symptoms, that is the joint symptoms and non-joint symptoms, where we ended up with discussing the treatment and the surgical procedures of rheumatoid arthritis. So, thank you, students.